So, what if the key to managing a chronic illness wasn't just in a doctor's prescription, but actually within the patient themselves? Today, we're going to dig into a really groundbreaking program from the Republic of Moldova called the Chronic Disease Self-Management Course. It's a pretty simple idea, but with a seriously powerful premise. Give patients the tools they need to take back control of their own health. Let's dive in and see how they did it.
To really get why this program is such a big deal, we have to start with this staggering global fact. Over half of all deaths worldwide are linked to chronic diseases. And think about it. Once you're diagnosed, the day-to-day grind, the choices, the monitoring, the mental exhaustion, all of that responsibility lands right on the shoulders of patients and their families.
So that huge global burden isn't just a statistic in a report. It has a very real, very human impact on countries all over the world. Let's zoom in on one of them, the Republic of Moldova, where these health challenges are especially tough.
Take a look at this number, 34.8%. That's the percentage of the Moldovan population dealing with high blood pressure. We're talking more than 1 in every 3 people. And what's even crazier is that about half of them aren't even being treated. This isn't just data, it's a quiet health crisis unfolding across the entire country.
And high blood pressure? Well, that's really just the tip of the iceberg. You've also got high cholesterol, widespread smoking, and heavy drinking, particularly among men. So what's the common thread here? All of these things are deeply tied to daily habits and lifestyle choices. And that tells you something really important. You can't solve this problem with the prescription pad alone. The solution has to be part of everyday life.
And this is exactly where Moldova's new approach comes into play. They realized the problem was way bigger than just medicine, so they completely shifted the focus. The goal wasn't just to treat the disease anymore, but to empower the person who was living with it.
So what exactly is chronic disease self-management? I mean, it's a mouthful, right? But it's not just about remembering to take your pills on time. It's about learning the skills to actually cope with the illness, the physical side, the emotional stress, and, this is the most important part, learning how to fit this new reality into your life so the illness doesn't get to define who you are.
And this really gets to the heart of the entire program. The real target wasn't just getting better numbers on a medical chart. It was about building something called self-efficacy, a psychological shift that can be more powerful than any medicine.
So what is self-efficacy? It sounds like a fancy psychology term, but it really boils down to one simple, powerful idea. It's your belief in yourself. It's the confidence that you actually have the power to manage your own actions, your motivation, and your surroundings to get something done. It's the difference between thinking, I have to do this, and knowing I can do this.
Okay, so the theory sounds great, but what does this chronic disease self-management course actually look like on the ground, for a real person in a small village in Moldova? Let's take a look inside.
The setup is actually brilliantly simple and all about community. It's a 6-week workshop. But here's the absolute key. It's not run by doctors. It's led by trained peer facilitators. These are people from the same community, and some even have chronic conditions themselves. Small groups, about 12 people, meet up every week to talk, learn, and, this is the most critical part, create and follow their own personal action plans for small, doable lifestyle changes.
And this quote from a facilitator points to a really unexpected but profound impact of the program. In a lot of these communities, especially in rural areas, people just don't talk about their emotions. So this course created a safe space for people to learn how to manage not just their physical symptoms, but their emotional stress too. For many, that was a brand new skill.
Okay, so we have a fantastic concept and some really powerful stories, but did it actually work? Let's get to the data and see what the results of this pilot program were.
The results are, well, they're pretty stunning. Just look at this. This chart shows the participants' confidence levels, their self-efficacy, before and after the program. The average score shot up from a 5.3 all the way to an 8.3. That's not just a little improvement, that is a massive, fundamental shift in how people saw their own ability to manage their health.
And that huge jump in confidence wasn't just some abstract number. It translated into real-world abilities. Participants said they felt more capable of managing everything, from physical pain and fatigue all the way to the emotional roller coaster that comes with their illness. It was a total upgrade in their ability to cope.
So we know the program worked, but do people actually like it? The answer is a resounding yes. A staggering 96% of the participants were satisfied with the course. They felt the information was trustworthy and that the peer-led groups were incredibly valuable.
That kind of buy-in from the community is absolutely crucial if you want a program like this to stick around. Look, a successful pilot is one thing, but making a real, lasting impact is a whole different ballgame. The next huge question for the chronic disease self-management course was, okay, what now?
The pilot was a clear home run, but that's just the first piece of the puzzle. The real challenge is making it last. How do you take this amazing idea and weave it into the very fabric of the healthcare system so it doesn't just vanish when the initial project funding dries up? That's the million-dollar question of sustainability.
So the research basically laid out two possible futures. Path A is where one single institution tries to take it all on. The risk there? It could easily get overwhelmed and collapse. But Path B, the much more promising route, is a partnership model. This would bring together a whole bunch of different organizations, national and local, to share the work and the resources, creating a much stronger, more resilient network.
At the end of the day, the chronic disease self-management course in Moldova is more than just a successful case study. It's a challenge to how we think about healthcare entirely. It leaves us all with a really powerful question to chew on. What would our healthcare system actually look like if we stopped treating patients like problems that need to be fixed and started seeing them as empowered partners in their own health?